Week 12, mini lecture 4. This is the final lecture episode for this week on the upper extremity, and in particular with respect to the elbow and wrist and forearm. In this particular episode, we are going to look at a couple of special rehabilitation considerations, in particular rehabilitation programs following an ulnar nerve transposition as well as dislocation. So let's first take a look at an ulnar nerve injury. What you can see on the far right of the screen is an ulnar nerve injury. It can really occur at any time or in any setting, but it is common in repetitive throwing sports, such as in baseball pitching. It will commonly be caused by poor mechanics, and the ulnar nerve can also be injured at the elbow due to repetitive typing or writing, compression from leaning on a flexed elbow, or acutely from a fall onto the elbow. Both operative and non-operative techniques are available for rehabilitation. In a surgical or operative type of technique, ulnar nerve transposition can be performed to essentially move the ulnar nerve from behind the medial condyle of the elbow to a better position so that it is no longer pinched or irritated. Individuals with this type of injury typically have pain at the site or tingling and numbness in the forearm and fingers. We are going to take a look in just a moment at a rehabilitation program for an ulnar nerve transposition. But first I will also speak to the elbow dislocation. When an elbow dislocation occurs, it is quite obvious. The area is deformed, and elbow dislocations tend to occur posteriorly and are due to sudden hyperextension and abduction force applications. The suggestions in Chapter 22 speak to a rehabilitation program after an initial care for a non-surgically repaired elbow dislocation. And in the case of an elbow dislocation, there is a splint that can be applied to immobilize the area for a few days until pain starts to subside, after which the splint can be removed but used on occasion when a fatigue occurs. After a few weeks, that is when rehabilitation can become more active. So in this case, once again, we're going to go over both of these rehabilitation programs. First, though, starting off with individuals who've had an ulnar nerve injury. So in this case, once again, there are 4 stages to rehabilitation, starting off with the inactive phase. During this phase, when we think about healing, an individual is very much in the inflammatory phase. The purpose of this initial phase of rehabilitation, once again, is to relieve pain, edema, muscle spasm, as well as protecting the surgical site as well. During this time period, a sling is worn by the patient. There are a series of exercises that can start to be performed, really just for range of motion and early isometric exercises for the shoulder and scapula region. Joint mobilization, the use of soft tissue techniques can also be performed. Above all, though, patients should avoid pain during those exercises. I should note that that first phase lasts upwards of 3 weeks, after which an individual is ready to enter the active phase of rehabilitation. This is also referred to when we think about healing as the early proliferation phase. During this period of time, patients actively are trying to restore range of motion, as well as making early muscle endurance and strength gains, and trying to restore proprioception and postural strength. Nonetheless, these types of exercises or treatment guidelines that are provided should be performed without pain, edema, or muscle spasm. Between weeks 4 and 6, individuals should regain full elbow and forearm range of motion, after which they can begin pain-free, light, resistive type exercises to promote supination and pronation. These types of exercises can be tolerated once again as long as there's no pain, edema, or muscle spasms. Additional progressive resistance type exercises can be performed for the surrounding region, including the shoulder, scapula, wrist, and hand. After this time period, proprioception type exercises that are weight bearing can be performed as well. I should also mention that during this time period, obviously cardiovascular type exercises to promote cardiovascular fitness can also be performed. Moving on to stage 3, or the resistive phase, this corresponds with the late proliferation phase of healing, and during this time period, once again, individuals should achieve full range of motion, strength, muscle endurance, proprioception, and as well, normal performance in triplanar motions. Individuals should try to also maintain their cardiovascular fitness, and all of this should be done without any sort of pain. It is during this resistive phase that more aggressive strengthening exercises, as tolerated, can be performed, in addition to the introduction of plyometric and agility type exercises for select patients. During the advanced phase of rehabilitation, this is the 4th and final phase of rehabilitation and corresponds to the remodeling phase with healing. During this time period, individuals should be able to perform functional and performance-specific activities, at least to pre-injury levels. This should enable participants to return to activities of daily living and sport as they would have done once again prior to the injury. As a result, the integration of functional and performance or sport-specific exercises should be included. Now moving on to a simple dislocation of the elbow. Once again, elbow dislocations are pretty obvious given the deformity of the region, and these types of elbow injuries tend to occur posteriorly and follow as a result of a very sudden hyperextension and abduction force application. The following rehabilitation program provides a series of progressions after the initial care of a non-surgically repaired simple elbow dislocation. As I've also mentioned, individuals typically are in an arm sling for a little while, and so after 3 days, a splint can be removed, but also reinstated once fatigue occurs. It should most likely take a few weeks before one can fully stop using the splint, and such active range of motion type exercises for the elbow, forearm, wrist, and fingers can be incorporated. Once again, there are a series of soft tissue and joint mobilization type exercises that can be introduced early on as well, and individuals should be able to also maintain certain strengthening exercises in adjacent regions, as well as cardiovascular fitness as tolerated. Home exercise programs can also be used to facilitate treatment in this case. Now, following those first few weeks, from weeks 3 till 6, following an elbow dislocation, individuals enter what is known as the active phase of rehabilitation, or this also corresponds to the early proliferation phase of healing. During this time, once again, pain should really be subsiding. Individuals should be trying to restore a full range of motion and also reducing risk of elbow muscle weakness by trying to work on muscle strength and achieve good postural strength as well. It is during this time period, so once again, 3 to 6 weeks post-injury, that individuals can start to work on range of motion, flexibility, as well as isometric strengthening exercises to the wrist and the hand. These exercises should be straight plane type exercises focusing on high repetitions to the elbow and forearm. As it is tolerated, progressions can include an increase in resistance. During the active phase, proprioception type exercises can also be incorporated as well. And as always, maintaining and trying to continue on with exercises that promote cardiovascular fitness. Next, in stage 3, or the resistive phase of rehabilitation, individuals with an elbow dislocation should be entirely pain-free, restoring their full range of motion in the elbow, wrist, and hand, as well as scapular muscle strength and endurance. Individuals should also be progressing by being able to perform both straight plane and multiplanar type activities in the upper extremity. During this time period, exercises can be focused on range of motion, strength and endurance, as well as progressing to those multiplanar exercises as I've mentioned. Dynamic proprioception type exercises and plyometric exercises may also be appropriate. Once again, home exercise programs can be used to facilitate this rehabilitation. Lastly, during the advanced phase of rehabilitation for an elbow dislocation, an individual should maintain normal strength and range of motion at all joints, but also be able to restore normal sport and work performance. This can be accomplished by incorporating functional and performance-specific exercises to promote full rehabilitation of the elbow and upper extremity. And that concludes this lecture episode.